Hi everyone, my name is Alexie Cruz, and today I'll be presenting a topic that truly resonated with me during my internship experience at a Star Pro Physical Therapy. It's called Recovery, Timeline, and Rehabilitation Strategies Following a Total Knee Replacement Surgery. Throughout this internship, I had the opportunity to witness firsthand what recovery looks like after a patient undergoes a total knee replacement, also known as a TKR. What struck me the most was that no two patients follow the exact same journey. This process is deeply personal and it combines science, art, and compassion. In this presentation, I'll guide you throughout what I observed in the clinic, how it connects to my course, exercise science at Lehman College, and how research continues to inform our clinical decision making in physical therapy settings. So in this next slide, I have a patient named Benjamin, a 29 years old construction foreman, faced a life-changing injury that led to a total knee replacement in March 2025. Despite his young age, post-traumatic arteries had several impacted his mobility and work of life. Throughout a 12 weeks rehabilitation program at a Star Pro Physical Therapy, Benjamin progressed from managing pain and swelling in phase one to regaining strength and independence in phase three. With hard work and with the guidance of his therapy team, he achieved of 120 degrees knee flexion and returned to a light duty work. Today, Benjamin will share his story to raise awareness about injury prevention and the importance of early rehab intervention. So this slide is an introduction and an overview. The total knee replacement is one of the most common orthopedic surgeries performed today, especially among older adults suffering from a chronic knee pain due to osteoarthritis. While the surgery itself is designed to revive pain and improve joint function, the truth is surgery is just the beginning. Rehabilitation plays a vital role in ensuring patients not only regaining mobility, but also return to meaningful activities and an independent lifestyle. Rehab typically spans to 12 weeks or more, and it follows a progression that starts with very gentle mobility and gradually moves towards strength training and functional independence. During my internship, I got to observe this full timeline in action. I saw patients go from using walkers or barely bending their knees to walking independently and regaining confidence. So, in this presentation, I'll share those observations, ties them to what we've learned in class, and backed up with some evidence-based research that validates our approach as future practitioners. This slides is an overview continued. The recovery process after a TKR is typically broken down into three main phases. So, phase one is an acute phase, which covers the first 2 weeks after surgery. The goal here is to reduce pain and swelling, intimate safe movement, and prevent post-op complications like blood clot. So the phase two is the subacute phase from about week 2 to week 6. Here, patient works on improving range of motion and starting to build back strength. Phase 3, the functional phase, spans from week 6 to week 12 and focusing on regaining strength and returning to activities of daily living, such as walking without a limp, climbing stairs, and standing from a seated position. What stood out to me the most was how individualized each patient's progression was. While we followed structured protocols, some therapists always made adjustments depending on how the patient felt that day. Like, meaning if a patient is feeling weak, we lower down the ankle weights or skip some exercises. Maybe it's due to the weather outside or how they're feeling of that day, their strength, and whatnot, X, Y, and Z's. So we adjust depending on how the patient felt that day. Something I know now and understand is a core principle of patient care centered. So, the importance in the field of physical therapy, according to over 75,000 total knee replacements are performed every year in the United States, and the number is projected to continue rising. That's very huge. But what people often overlook is that the success of the surgery is heavily dependent on what happens after in rehabilitation. Give me one moment. Let me double check if I'm recording. Yes. Anyways, in a proper rehab isn't carried out, patients may continue to experience pain, have limited range of motion, or worsen. It develops poor walking patterns that put stress on other joints. This can lead to additional injuries and increased healthcare costs. Physical therapies are the heart of this process, where we are the ones who guide patients throughout the exercise. Sorry. Monitor them with their progress, adapt their programs, and keep them motivated, especially keep them motivated. That's why understanding TKR rehab is so important, not just for the patient, but for us future clinicians. It's a reasonable, it's a responsibility we need to take seriously because we directly impacted someone's ability to move, live, and thrive. In this next slide, I will speak about clinicals and academic. So one of the things I love about this internship was how often I found myself mentally referring back to what I learned in class. For example, from my biomechanics, I understood how a patient's altered patterns could shift force to the hip or spine. In motor control, we studied how the brain and nervous system adapt after injury or surgery, which I saw in real time as a patient relearned how to use their leg properly. And in exercise prescription, I believe I took that 2 semesters ago. We learned how to build safe, effective routines for rehab, choosing the right sets, reps, and progression strategies based on the patient's needs. Physical therapy is truly the perfect blend of science and empathy. We use evidence-based timelines to guide us, but we always stay flexible, adjusting to what the patient is experiencing physically and emotionally and mentally. This experience helped me connect the dots between the academic world and the human side of care. So, clinical observation phase one, week 0 to 2. During the first 2 weeks post-surgery, patients are often in pain, dealing with swelling, and just starting to regain trust in their body. My job was to assist the therapist in helping patients start small but accessible movements like ankle pumps, quad sets, and heel slides. These exercises might seem simple, but they are vital. For example, ankle pumps prevent dangerous blood clogs, and quad sets begin reactivating the quadriceps, a muscle that is commonly shut down due to surgery induced. I saw how small wins in this stage, like lifting the leg for the first time, made patient feel hopeful. This phase also taught me the value of reassurance. Just being there to encourage a patient helps them breathe through discomfort, or explaining why they're doing a significant movement made a huge difference. This portion is the clinical observation phase two, which is weeks 2 and 6. By the second phase, patient typically becomes more engaged. I work with them on seated knee extensions, short arc quads, and heel props. These exercises were used to improve knee flexion and extensions. One patient I work with sorry, one patient I work with couldn't bend her knee past 7 degrees. She felt very discouraged, but we kept showing up doing reps, modifying positions, using heat before session. They love the heat. They ask for more than about 10 minutes. I'm like, I have to explain that their therapy is usually an hour to an hour and 10, but they want to sit and use heat and ice, but that's okay. Um, anyways, by the third week, she reached 95 degrees. Her confidence shoot up, and so did her smile. The moment reminded me how much progress depends on both physical effort and mental resilience. Sorry. Research shows that achieving key milestones during this window, especially between 90 to 120 degrees of flexion, strongly correlates with long-term success. So even through this phase is tough, it's incredibly important for setting the tone for the rest of the recovery. The slide is a clinical observation, phase 3, week 6 to 12. This is where things get even more exciting. Patient work on sit to stand, step up and over, or step ups, stationary bike, and resistant bands exercises. The goals was not just to move, but to move well and independently. I helped the coach I helped to coach patients on proper form and watch them regain trust in their knee. Training was especially impactful. Some patient would favor one leg or limp unconsistently. Sorry. And correcting this early was key to preventing long-term imbalance. This research by Mintz Low back in 2007 emphasized that structured strength training and functional training dramatically improve quality of life and independence. Seeing patients take their first unassisted steps or confidently climb stairs made all the hard work worth it. Clinical application of evidence-based practice. In school, we always hear the phrase evidence-based practice, and during this internship, I saw what that really means. For example, the goal was to hit 0 degrees extension and 110 to 120 degrees flexion by 8 to 12 weeks. But not every patient followed this perfectly. It's if someone had swelling or high pain level will adjust and maybe using mobilities like ice or evaluating the leg more often. If someone progressed faster than expected, we increase the difficulty to preventing it. This is where the art of PT means to science. Research by Posey back in 2013 supports this flexible, adaptive approach, showing that tailoring rehab to the patient's daily readiness improves outcomes. At the end of the day, the protocol is to guide, but the patient's experience tells the real story. Lastly, this is my conclusion portion. This internship taught me so much more than just exercising and anatomy. It taught me how to support people when they're at their most vulnerable and help them get back to doing the things they love. I witnessed tears of frustrations and joy. I saw how setbacks were part of the process and sorry, and how perseverance always pays off. This experience deepened my love of physical therapy. It reminded me that every patient has a story, and we're there to help them rewrite that story. One rep, one breath, and one small victory at a time. I'm more excited than ever to continue this journey and be part of the healing process. This is my reference page. Thank you for listening. Any questions, comments, or feedbacks is more than welcome. Thank you for listening and have a lovely evening. Bye-bye.